Welcome to the deep dive. We often plunge into topics that might seem a bit niche at first glance, but they quickly reveal some really surprising insights.
Yeah, into animal behavior, instinct.
Exactly. And the critical role human intervention can sometimes play.
Mm-hmm.
Today, we're taking a deep dive into something quite complex and honestly often distressing: maternal foal rejection in horses.
Right. And we've gathered, quite a bit of material for this, veterinary sources, research papers, clinical notes.
So the goal, really,
Yeah, our mission for you, the listener, is to kind of pull out the most important nuggets of knowledge, help you understand the causes, spot the signs, and know the crucial treatment steps. It's a challenging one.
it definitely is a sensitive topic, no doubt,
Mm.
but understanding it is just so vital for animal welfare. And actually, there's some really fascinating bits about mare behavior and, like you said, the power of intervention that we'll get into.
Absolutely.
Okay, so let's start with the basics then. What exactly is maternal foal rejection? I mean,
Yeah.
fundamentally.
Well, fundamentally, we see it in two main ways. Either the mare just rejects the foal's attempts to nurse.
Just won't let it.
Right. Or she shows overt aggression towards the foal, which can be quite shocking.
Yeah.
And the interesting thing is this behavior, it's incredibly complex. It's very rarely, malicious. It seems deeply influenced by instinct.
It did stink, Bo.
And what's also key is that it can happen even if the mare seems perfectly healthy physically, but, and this is important, any painful condition, something like mastitis, can definitely trigger it.
Okay, and here's something that really caught my eye. The role of smell. You're saying a mare identifies her foal mainly by its scent.
Hugely important, yes. Smell is critical for recognition, which leads to this concept of iatrogenic foal rejection.
Caused by treatment.
Exactly, a rejection caused by medical intervention. If the foal's natural smell changes too much, maybe from lots of handling, medications, cleaning solutions, that sort of thing, the mare might not recognize it.
Wow, okay. And who does this tend to affect most? Is there a pattern?
There is somewhat. I mean, it can happen in any breed, any age mare, but it's definitely more common in primiparous mares, those having their first foal.
First-timers.
Right. And we also see a higher incidence in Arabians for reasons that aren't entirely clear. Genetics, maybe? And timing-wise, it most often shows up right after birth, immediately postpartum. But sometimes it can pop up hours or even months after she seemed to accept the foal initially.
That's surprising. Months later.
It is, yeah. Less common, but it happens.
And the research points to the central nervous system being involved, even if the how is still a mystery.
That's right. The specific mechanism isn't pinned down, but it seems to be neurologically based, not just a simple reaction, which tells you how deep this runs.
Incredible. So if we try to connect the dots,
Yeah.
it sounds like it's rarely just one thing.
Almost never just one thing. It stems from this mix of factors, psychological, physiological, environmental influences, often all tangled together.
It really shows how delicate that mare-foal bond is, doesn't it? Like a complex symphony, as you said, where one wrong note.
Exactly. One little thing goes wrong, and it can disrupt this absolutely life-saving connection.
Okay, so let's dig into those factors. The first-time mothers, why are they more prone? It feels like they're already dealing with so much.
Well, inexperience is a huge part of it. They might genuinely be confused, maybe even scared by the whole birth process and this new creature that suddenly appears.
Overwhelmed.
Totally. And pain is a big one, too. Post-foaling pain, like strong uterine contractions, maybe perineal tears, that makes anyone irritable.
Sure.
And then there's the udder. If it's really full and tight turgid, it can be incredibly painful when the foal first tries to suckle. She hasn't learned yet that suckling actually relieves that pressure.
Ah, okay, so she associates the foal with pain initially.
Potentially, yes. And just general fear and anxiety about the foal itself can be a trigger.
Okay, so beyond those first-time jitters, what about other physical issues? Underlying health problems.
Right, so any significant pain, really. We mentioned perineal lacerations, strong contractions, but also mammary gland problems are key.
Like mastitis.
Mastitis, yeah, or even just really pendulous, painful udders, or udders that are just incredibly full and tight. Anything making nursing uncomfortable.
Makes sense.
Hormonal imbalances could play a role too, particularly with oxytocin. That's the bonding hormone, crucial for milk letdown if that's off.
Right, the bonding process is disrupted.
Potentially. And then, of course, if the mare simply isn't producing milk agalexia, that leads to frustration for both of them. Or if the mare herself is ill, weak, maybe stressed, she might just lack the energy or the drive to care for the foal.
So we've talked a lot about the mare side,
Hmm.
but can the foal itself, its condition, contribute to the rejection? That seems kind of counterintuitive.
It does, but yes, absolutely. Think about it. If a foal is weak, maybe sick, premature, really struggling, it might not trigger the mare's maternal instincts in the right way.
Ah, she might perceive it as not viable.
Exactly, like it's unfit to survive. It sounds harsh, but it's instinct.
Yeah.
And as we touched on, that unusual odor from medicine, too much human handling that can be a factor. Or even though it's rare, if the foal looks somehow abnormal to her, it's definitely a two-way street, that initial bonding process.
Okay, so we've covered the internal stuff, the mare's body, her experience, the foal's condition. But sometimes the environment itself is the problem, right?
Precisely. The surroundings matter hugely. Too much human interference right after birth, especially before the mare's had that crucial time to lick and bond,
Right.
that can really mess things up.
Interrupting that natural process.
Completely. And think about a stressful environment. Maybe no privacy, loud noises, strange people milling about, other animals too close. That can cause a lot of anxiety for the mare.
Yeah, I could see that.
And even poor nutrition. If the mare is weak because she hasn't been fed properly, that can lead to poor milk production, which indirectly contributes.
And you mentioned genetics earlier and past behavior.
Yes, genetics might play a part. We see it more in Arabians and certain family lines. And definitely a mare who has rejected a foal before is, unfortunately, more likely to do it again.
A pattern emerges.
It can, yes. And just a really chaotic or unusual situation at the time of birth, anything that makes the mare feel unsafe or unsettled, that definitely increases the risk.
Okay, so given this whole complex picture,
Mm.
how do you actually know if a mare is rejecting her foal? What are the signs someone should be watching for?
And recognizing them early is just critical because, like we said, it's a spectrum. It can range from pretty subtle disinterest
Right.
all the way to outright aggression.
So what does the mild end look like, the disinterest?
Well, the mare might just seem to ignore the foal, doesn't nuzzle it much, maybe just walks away when the foal comes near. A really key sign right after birth is if she doesn't lick and clean the foal thoroughly. That's usually a strong bonding behavior.
Okay.
She might not position herself to make nursing easy, or she might just wander off when the foal tries to latch on. It's more passive, but still rejection.
And the more severe end? The aggression? What does that look like?
That's much more active. She'll deliberately move away, maybe swing her hindquarters towards the foal as a threat. You'll see pin ears, maybe aggressive tail swishing, stomping a foot.
Clear warnings.
Definitely. And the most dangerous signs are biting or kicking at the foal, especially when it tries to nurse. That's a huge risk. She'll actively block nursing attempts, and often she'll seem anxious or restless herself, clearly upset by the foal's presence.
Gosh. So this brings up the foal side again.
Yeah.
What signs would you see in the foal if it's being rejected and not getting what it needs? It must be incredibly vulnerable.
Terribly vulnerable. You'll see pretty obvious signs of weakness, lethargy. It's not getting that vital colostrum in milk.
Right, the energy source.
Exactly.
Yeah.
You'll see it trying to nurse repeatedly, but failing because the mare stops it. Then you look for signs of hypothermia, getting cold. Dehydration is a big one. Sunken eyes, maybe tacky gums.
Oh dear.
Sometimes colic or diarrhea can develop from insufficient or irregular feeding. Low blood sugar hypoglycemia is a risk. And then, tragically, you might see signs of actual physical trauma if the mare has been aggressive. Starvation is the ultimate outcome if nothing changes. It's grim.
It sounds incredibly challenging for everyone involved. So when this happens, what's the approach? What do experts recommend for treatment and intervention?
It really has to be a multi-pronged approach. You've got two urgent priorities: keeping the foal safe and healthy, and trying to establish that bond. And the sooner you intervene, the better the chances.
Makes sense. Full safety first.
Absolutely. If the mare is aggressive, you have to separate them immediately, no question. Prevent injury. Then focus on getting colostrum into that foal within the first, say, 6 to 12 hours. That first milk is critical.
How much?
Ideally 1 to 2 liters. You might be able to carefully milk the mare, but often you'll need banked colostrum from another mare or a good commercial replacer. Then it's nutritional support, usually bottle feeding. If the foal is very weak, it might need IV fluids, maybe glucose. Keeping it warm is essential, and a full vet checkup is crucial to assess its overall health.
Right. And what about helping the mare? Can you treat her side of the equation?
Yes, definitely. Addressing any underlying cause is key. So pain management is huge, using NSAIDs, anti-inflammatories, for post-foaling pain or utter soreness.
Like bute or banamine?
Exactly. Drugs like flunixin, meglumin, or ketoprofen, under vet guidance, of course. You need to check her udder carefully. Is it mastitis? Is it just painfully engorged? Gently milking her can sometimes relieve that pressure and discomfort.
Okay.
And a thorough vet exam for the mare herself, looking for any physical issues from the foaling or any other illness.
Are there medications specifically for the rejection behavior itself?
There are things veterinarians might consider carefully. Mild sedation using something like acepromazine can sometimes calm an anxious or mildly aggressive mare enough to allow safe nursing.
Just takes the edge off.
Kind of. Or medication like butorphanol can help specifically with udder pain. Sometimes very small repeated doses of oxytocin, again under close vet supervision, might help with milk letdown and maybe even promote bonding.
Interesting.
But it's complex. For instance, there's a critical note. Certain tranquilizers, like benzodiazepines, think Valium, are actually contraindicated. They can sometimes disinhibit aggression, making a bad situation worse.
Oh, wow. Good to know.
Yeah. Other things like anxiolytics for fearful mares or progestins for aggressive ones are sometimes tried, but these are often extra label uses, requiring really careful consideration and owner consent. It's definitely vet territory.
Absolutely. Okay, so you've got the full safe. You're managing the mare's potential issues. Then comes the really hard part, it sounds like, trying to get them to actually bond. How do you even approach that?
It is the hard part, and it takes immense patience. The key is controlled reintroduction. Often this means physically restraining the mare, maybe in stocks or using cross ties, or even a sturdy partition or pole that protects the person helping, but allows the full access to nurse safely. The goal is to let the full nurse without risk.
Okay.
Sometimes putting them in a small, very safe stall helps somewhere the mare can't easily just bolt away from the foal, confining the interaction.
And you mentioned sensory things earlier, like smell.
Yes, those sensory manipulation techniques are fascinating and sometimes really effective. If the bonding was interrupted right at birth, sometimes rubbing the foal with the mare's own placenta or birth fluids can help.
Kind of restarting the process.
Exactly. And the Vicks Vapor Rub technique is quite common, rubbing that strong-smelling stuff on the foal's hindquarters and also on the mare's nostrils.
To mask the foal's scent.
Pretty much. The idea is the strong Vicks smell overrides or confuses her perception of the foal's own odor, potentially tricking her, or at least reducing her aversion, long enough for nursing to happen. I read one case study where it seemed to make all the difference. Another, maybe less appealing method is rubbing a bit of the mare's fresh feces on the foal's hindquarters. Again, trying to use familiar, powerful scents.
Whatever works, I guess.
In these situations, absolutely. But the overarching theme here is patience and persistence. You need consistent, supervised efforts. You might have to restrain the mare for every single nursing session for at least, say, 3 days.
Wow, that's intensive.
It is. And the tough reality is if you don't see significant improvement in the mare's behavior within about 7 days, acceptance becomes pretty unlikely.
A week is kind of the window.
It often seems to be, yeah.
Yeah.
You need close supervision for at least the first 24 hours after reintroduction, and then really intensive monitoring until you see her consistently letting the foal suckle without any aggression for several hours straight.
Okay. So, what happens long term? If it works, great. But if it doesn't, what are the implications?
Well, ongoing monitoring is always essential, even if things seem better. But if all these attempts fail, if the mare just won't accept the foal, the last resort to save the foal's life is often finding a nurse mare.
Another mare who can raise it?
Exactly. A mare who recently foaled herself, maybe lost her own foal or had it weaned early, and is willing to accept an orphan. But finding and managing a nurse mare situation is complex and can be quite costly.
Right.
And this whole experience raises a really important question for the owner, especially regarding future breeding. A mare that rejects her first foal, well, she's statistically more likely to reject future foals too.
Oh, really?
Yes. So any plans for breeding her again need a serious discussion with a veterinarian. It might be a recurring issue.
Gosh. Okay, so wrapping this up.
Yeah.
What does this all mean? This has been a really deep dive into something quite specific, but what's the takeaway?
I think it shows us this incredible intersection, doesn't it? Instinct, pain, the environment, the foal's condition, and then skillful, sometimes intensive, human intervention.
Yeah, it's a powerful example of how understanding these really complex animal behaviors can genuinely be life-saving.
Definitely. We've seen how vital that early recognition is, and the need for that multi-pronged approach, always putting the foal's immediate survival first, while still working patiently to try and forge that crucial mare-foal bond, even when the odds seem stacked against you.
It really makes you wonder, doesn't it, about that delicate balance between, those powerful innate maternal instincts and the potential for learning, for adaptation, even in these really difficult circumstances.
Mm,
Could it be that sometimes that careful human intervention isn't fighting nature, but actually helping it find its way back? Helping bridge a gap caused by pain or fear?
that's certainly something to ponder
Yeah.
until our next deep dive.